Access to affordable health care is everyone's concern, especially as we consider the impending changes brought about by the Affordable Care Act. I'm Nathan O'Leary for Comcast Newsmakers at the University of Massachusetts Amherst, and Sister Caritas, Vice President of the Sisters of Providence, will discuss health care in relation to the Sisters of Providence Health System. And welcome, Sister.
Thank you.
In 1984, the Sisters of Providence Health System, it took a closer look at itself and made some sweeping changes. Can you talk about that?
Yes, we've been here since 1873, and we've always had health care in all of its forms. We like to say we take care of people from the cradle to the grave. Back in 1984, we took a look at all of our programs, and we had acute care, long-term care, child care, community-based programs and services. And so there was no connection between them, and we decided at that time that it would make much more sense if we put them together in a coordinated fashion. So we created the Sisters of Providence Health System. So instead of operating as silos, they now operate across the full spectrum. So it's providing a much more much better opportunity for continuum of care for people as they go through the system, so they're not just in the hospital, right, at home, or wherever. So we watch the person across the full spectrum.
Now, as we come up to the Affordable Care Act, it has a number of requirements. How is the Sisters of Providence Health System, how is it ready for that?
I think we're perhaps more ready than most, in as much as back in '84 we put together this system, and we do have a coordination of care. One of the elements of the Affordable Care Act is to care of the whole person, not just the hospitalized patient or the home care person, but watch the person through across it. And it's a case of doing disease care as opposed to episodic care. So if someone has a chronic illness, you watch that person. So we have already organized our facilities, and now it's just a case of getting the other elements together, such as better IT, so you can have a closer watch on people. But I think we're perhaps positioned more clearly than many.
One of the programs that you guys are best known for is the Bright Side residential program for children. That, though, has changed significantly.
That's changed significantly. Back in 2011, the state decided they no longer wanted residential care for children. So we are now continuing that program in a program called Family Stabilization. And we work with families and children who are in difficulty. We work with the families in the home setting. That gave us that property to find another use for us. So we're doing some very creative things now. We already have a home care and hospice program there. We'll have a PACE program, which is a comprehensive program for elders, and then we're planning to put in some low elderly housing. So what we'll have is a campus where people will have housing with all the support services, which is critical.
Now, finally, too, you have a number of innovative programs across a broad spectrum. Could you pick one of those just to give people an idea?
Well, we have so many. We have health care for the homeless. We have Providence Ministries for the Needy up in Holyoke, which is just a wonderful program for those that need. We converted a home that we had on One Mother's to Genesis Spiritual Life Center, which is a haven for people in difficulty. They can come there and get their mind, body, and spirit renewed. We have a program for the Vietnamese up in the Forest Park area of Springfield. Needs like that. We have always tried to respond to the needs, not stay with what we had, but move forward with the needs that they arouse, and meet the needs of people wherever they are.
What inspires you to do all of this work that you do?
I guess just seeing the needs, and you become energized when you see that there's a need to be addressed, and I get new energy whenever there's a chance to do something new.
All right. Thank you very much, Sister Caritas, Vice President of Sisters of Providence Health Systems. Thank you for joining us, and thank you for joining us for Comcast Newsmakers. I'm Nathan O'Leary.